get more devices for mechanical ventilation, do the swab to everybody within the hospital, and be aware that somebody will not make it anyway.
People who are weak, people who are scared, and I'm not gonna lie,
really pleased to be able to treat patients again, really pleased to be able to get back into it. At the moment, my team in the intensive care unit are looking after a lot of patients who are critically unwell with coronavirus.
Non è solo la quarantena, è anche il sentirmi sporca, quindi non riuscire a...
This is a gathering of nurses, doctors, and other healthcare workers who are being unnecessarily exposed to the virus. We see that the colleagues who have already died, those were absolutely preventable deaths.
With severe respiratory distress, immediately in the next 2-3 hours, we received 10, 8, 9 patients exactly with the same clinical presentation.
Portion of patients that are critically ill, younger, people that look just like us, and older, it's overwhelming.
C'est un peu l'inconnu puisque c'est quelque chose qui n'arrive pas tous les jours.
We've gone into the operating theatres now, so we've got another 3 ventilated patients in the operating theatres, so I'm going to put my visor on and see if I can go and help.
Not all heroes wear capes. Not all heroes carry weapons. Today, across the world, an army of white coat soldiers is battling an enemy invisible to the naked eye. Whether it is Italy, China, or India, the United Kingdom, or the United States of America, the mission of this white coat army is the same: to wage a war on the deadly novel coronavirus. And in this case, the enemy is highly contagious. It has infected more than 1.6 million people worldwide and taken nearly 100,000 lives. COVID-19 is also taking a serious toll on the doctors and nurses who are risking their lives while treating infected patients.
We had a few patients die in the emergency room because the hospital's full.
The morgues are already getting overwhelmed.
It just feels like you're standing on the shore looking at a tsunami, and the federal government is offering you a life preserver.
This is one of the most dramatic things that I've ever seen.
This is very distressing to me because I don't know if this is going to be the next shift that I go in and I get the virus.
Caught between the disease and death, these frontline healthcare workers are the true heroes of this war. Today, we take you inside medical war zones to hear their stories and understand their challenges, because the world needs their help more than ever.
Okay, so it is the morning of Sunday, April 5th, and I have just finished my night shift. And I'm gonna get ready to, I'm actually getting ready to go home now. I walked out. A little mark here from wearing my mask all day. But we made it through, and I'm gonna head home and get a little rest.
Last night before I went to bed, we had over 60 patients waiting for a hospital bed in our emergency department with COVID-19. So I don't know what this morning is going to be like, but it's probably not going to be that much different than last night, meaning it's going to be a busy day. It's been tough.
Now, I'm going to head upstairs now.
Critical care physician Dr. Sanam Ahmed just completed a night shift at Mount Sinai Hospital, New York City.
This right here.
While emergency room physician Matthew Bai is getting ready to go into a COVID-19 war zone.
It's a little hard to breathe. It stays on the whole day to protect us from any airborne particles.
I guess when I left my house today, I sort of had mixed feelings. On one hand, I left my kids at home so that I could go and fight this war along with my colleagues. But on the other hand, I feel optimistic. I feel hopeful because as a critical care physician, this is what we've trained for. We know that this is what we have to do, and we know that we're well equipped to do it.
And lastly,
Dr. Matthew Bai also had to make a very difficult decision today to send his wife and 17-month-old daughter away for their own safety.
it's been tough. I don't know how long it's going to be, but this morning when I left the house, I said goodbye to my wife and my daughter for who knows how long. It's going to be several weeks probably before I see them in person again.
That's the price most medics who are fighting the coronavirus pandemic are paying around the globe, not knowing when it will be safe to see their family in person again. And it's not easy.
There was one of my colleagues told me this amazing story where he was talking to a patient who was infected. He's talking to this patient and saying, look, if this escalates quickly, would you want a breathing tube? Would you want to be on life support?
Hospitals in the world's richest country are overwhelmed. Equipment, supplies, and trained staff members are depleting rapidly. It's a battle with time.
The things that I see in the ER are scary. I'm a little scared myself. It's not going to be easy. I mean, it's going to be really tough, and it's only going to get tougher over the next 2 weeks. But we'll get through this as best as we can, and we'll try to use the resources that we have as best as we can to help as many people as we can.
On April the 10th, the United States became the first country to record more than 2,000 coronavirus deaths in one day, with 2,108 fatalities in just 24 hours. With ventilators in short supply, this hospital is repurposing machines used to treat sleep apnea to help some COVID-19 patients. But at this point of time, more than anything else, it's the resilience of the staff that matters more than anything.
Hi guys, how you guys doing?
We're doing good, hanging in.
Working hard?
Yeah, fighting the COVID.
Fighting the good fight. Yeah, keep working hard guys. We love you. So we have patients here ranging in age from 31 to in the 80s, and we're working hard to save them. We have our ICU team here. Hi guys.
Hey.
Everybody's working hard, awake despite the late hour. For whoever needs them throughout the night. Didn't know about that.
This is where the team comes together to save lives.
I also feel hopeful because despite how challenging my night will be, we hear good things every day. Today before I was leaving the house, one of my colleagues had texted, and she just texted a number. She texted a number and said, this is the number of patients whose lives we have been saving over just the past day. This is the number of patients that we have successfully gotten off of a ventilator.
it's sort of a reminder of the resilience that we have as human beings, and that together we're going to overcome this.
Doctors around the world are being challenged by a virus about which a lot remains unknown. But there are many heartwarming stories. In Peru, 2 babies born to mothers who tested positive for coronavirus have tested negative for COVID-19. The team had to follow strict biosecurity protocols during the cesarean births.
It's worth highlighting that it has been a multidisciplinary work. Both deliveries were done by cesarean, so fortunately there wasn't a vertical transmission, meaning that there wasn't a transmission of the coronavirus from the mothers to the newborn.
The novel coronavirus has killed over 200 doctors and nurses around the world, including in China, Italy, Spain, USA, France, England, Iran, and India. But why are clinicians so vulnerable? The novel coronavirus is spread via close contact through respiratory droplets produced when an infected person coughs or sneezes. So the risk of transmission to a clinician is very high.
I do worry about my staff because they're being exposed to patients who have a dangerous disease.
Medical professionals around the world are demanding personal protective equipment and N95 surgical masks for their own safety. Without these, they are risking their lives to save patients. In many countries, including India, they are resorting to desperate measures to protect themselves, such as using HIV kits instead of PPE, and reusing disposable gloves after sanitizing them.
When we went today, at last, after we gave huge pressure, he gave us a letter he sent to the ward, 1 packet. He told it is in place of PPE, there was a raincoat. Okay, raincoat, and with that the scientific goggles, no scientific goggles, they provided a sunglass, black colored sunglass. You know, a physician needs to see the color of the patient, various symptoms he needs to see. A black colored sunglass in place of the scientific goggles. And no mask, nothing they are providing.
According to the WHO, an estimated 89 million medical masks are required for the COVID-19 response each month. For examination gloves, that figure goes up to 76 million, while international demand for goggles stands at 1.6 million per month. Most countries are facing an acute shortage, so what's the solution? Countries need to do more to discourage the panic buying, hoarding, and misuse of protective equipment, which healthcare workers need more than the rest of us. Many veteran physicians and nurses are also working in hospitals despite the heightened risk for older people. Alpha Sadhu, a retired 68-year-old British doctor, returned to work to help battle UK's coronavirus outbreak. Unfortunately, he died of the disease recently. And who can forget the heroic Dr. Li Wenliang, the Chinese whistleblower who sounded the alarm on the Wuhan coronavirus, but was told by the government to stop making false comments. Dr. Li contracted the virus while continuing to work at Wuhan Central Hospital, where he passed away at the age of just 33. Iranian doctor Dr. Shirin Rouhani too lost her life while treating coronavirus patients. Reports suggest that she kept working till her last breath to help others infected by the virus, as the hospital was severely short-staffed. In Europe, the virus has knocked thousands of health workers out of action. Italy has been the worst hit. The coronavirus death toll among doctors has crossed 100. France also reported the death of 5 doctors related to coronavirus. In Spain, the depleting ranks of healthcare workers is hampering the ability to fight the outbreak.
I'd like to tell you that I got coronavirus from heroically looking after some of these patients, but actually the reality is much more mundane. I think I probably caught this from contact with colleagues at work, possibly, and possibly someone out in the street before any of the coronavirus patients really arrived on the intensive care unit. It started off very innocuously. I had a burning sensation in my nose. I lost the sense of taste. I never had a cough. And then I've had a week of just feeling absolutely terrible, aching muscles, aching bones, and unable to get out of bed, sleeping 16, 18 hours a day. I'm on the mend now, thankfully, I hope. But I can't emphasise to you how sick this can make you. Please, please listen to the advice that's going around at the minute. This is a small sacrifice for a short period of time, and then life will get back to normal again.
In India, the first case of a doctor succumbing to coronavirus infection was reported in Madhya Pradesh. On March the 25th, the government appealed to retired doctors to join the efforts to fight the outbreak, and the response has been heartening. More than 31,000 have volunteered for the cause. The pandemic has severely disrupted life in Spain and Italy. Italy has reported more than twice as many deaths than China, where the virus first emerged in late 2019. And Spain's death toll is also significantly above China's. Spain also has the world's highest reported rate of COVID-19 infection for doctors and nurses. According to Spain's health ministry, about 15,000 health workers are now sick or self-isolating, making up 14% of confirmed cases in the country. In Italy, the figure is below 10%. No other country has reported a double-digit percentage of cases affecting doctors. In the Spanish city of Toledo, medical staff with coronavirus symptoms are being fast tested by kits imported from China.
This operation consists of making fast tests for those professionals, either health staff or people belonging to essential services. We need to replace them as quickly as possible.
In this test, a puncture is made on the finger and it gives the result in 10 minutes. If it's negative, the person gets a second test by cotton swabs in the nose. However, Spain reportedly found that rapid coronavirus test kits purchased from a Chinese firm could only identify 30% of the virus, and thousands of them were returned. Similar concerns have been raised by other countries such as Georgia and Czech Republic. According to a 2019 parliamentary report, India has just one doctor for every 1,457 citizens. For most people, the lockdown has resulted in more time being spent with their family, but these medics are having to practice social distancing with their own loved ones. One such fighter is Dr. Sachin Nayak from Bhopal's JP Hospital. He had stopped going home after work and had been living in his car to reduce the risk of infection. But after spending weeks in his vehicle, he has now shifted to a hotel arranged by the hospital. Doctors are working around the clock in the fight against COVID-19. But in some cases, these overworked medical professionals are also having to battle another enemy: social stigma. Shocking instances of healthcare workers being ostracized have emerged on social media. Taking note of the matter, India's Health Minister Dr. Harshvardhan appealed to people to stop the harassment. He also said that strict action would be taken against the abusers under the Epidemic Diseases Act. In another instance, 2 women doctors from Indore were injured when a team of health officials was pelted with stones while they were trying to trace a person who had come into contact with a COVID-19 patient. And these shocking visuals are from Quetta, the capital of Balochistan, Pakistan's largest but poorest province. Police arrested at least 50 doctors who were denouncing shortages of personal protective equipment. Basic protective equipment has been made available to only those healthcare professionals deployed in dedicated coronavirus wards, leaving doctors working in other wards vulnerable. According to government data, dozens of doctors have been infected and 2 doctors have died after contracting the virus in Pakistan. A shortage of personal protective equipment, a lack of ventilators, sick patients, overcrowded hospitals, the risk of getting infected themselves and passing on the disease to their family members. These are the challenges that healthcare professionals on the front lines are facing in almost every country in the world. And these weary faces, bruised and crinkled from wearing masks and goggles for long hours, tell the story. Nurses and doctors from various countries have been sharing these images.
What's your names?
My name's Harris.
Hello, Harris.
Hi, Harris.
During Easter week, Britain's Prince William and his wife Catherine paid a virtual visit to a British primary school, which had been kept for children of frontline staff battling the coronavirus pandemic.
This is a picture of my mum, and she works for the NHS as an admin for the health visitors, and I'm really proud of her.
2 kids, Harris and Lloyd, showed hand-drawn pictures of their mothers and said they were happy to be in school.
Well done.
Well done, it's brilliant. I agree, you should be very proud of her. They're doing an amazing job, all the NHS workers, so well done you. Thank you.
April the 7th is designated as World Health Day. This year, on this day, the Cinderella Castle at Disney's Magic Kingdom in Florida was lit in the color blue, as a symbol of gratitude for medical workers. Celebrities are also coming forward to thank these real-life heroes. Bollywood superstar Akshay Kumar launched a campaign called #Dil Se Thank You to show his appreciation for frontline warriors.
Facebook हो या Twitter हो या Instagram पर शेयर करें #Dil Se Thank You के साथ. Guys, let's show our gratitude, because that is the least we can do.
Many other prominent faces have also joined him.
Other people who want to say thank you as well.
Many real-life doctors from popular television shows like Scrubs, Grey's Anatomy and House also united to pay tribute to their real-life counterparts.
All of you real-life doctors and nurses, thank you so much for everything you're doing to get our world through this.
Indian origin Basha Mukherjee, the reigning Miss England, has returned to the National Health Service as a junior doctor, saying it was natural that she continued her job during the coronavirus pandemic. The 24-year-old was in India for charity work, but she left midway when the coronavirus crisis worsened to answer the call of duty as a respiratory specialist.
There were thousands of doctors returning to work who were retired doctors, and one of my colleagues reached out to me, not in a way to guilt trip me or anything, but just to give me a picture of what was really going on in terms of how long the shifts were that they were putting in and how much pressure they were under. And my natural response was, well, I want to be part of that and join in. The more hands, the better, really, to share the load. That's what I was thinking.
Social media is flooded with videos of people coming out on their balconies as they applaud, cheer and light candles to thank medical workers in all corners of the earth. This appreciation matters, but they also need us to follow their advice, to stay at home, wash our hands and practice social distancing, because these acts will play a big role in flattening the curve and curbing the spread of the virus. And above all, these nurses and doctors need assurance that they will have access to and not run out of personal protective equipment and ventilators, because until a cure is discovered, it's the only way to win this battle.